Hi friends, I have the honor and pleasure of having with me Dr. Ronnie George, rank 62, November 2017 AIMS. Congratulations, great rank. How are you feeling today?
So I feel finally relieved and also happy, and finally I get an idea like how the exam pattern is, and I got a decent rank. So I'm finally relieved. That's it.
So you're feeling relieved
Yeah,
and happy as well,
yeah,
and it's a great rank. I want to tell you that around 50,000 students actually sit for November AIMS exam.
yeah,
It's a great rank.
yeah. Thank you, sir.
And I also want you to talk about, like, you were a student of our test and discussion course in Delhi,
Yes, sir.
and I want to know how was your experience with the test and discussion course?
Yeah, I joined the T&D program from January this year, 2017 session, and actually it was like the format was really good. So we had weekly classes, and so we can prepare like a topic like a particular subject for 1 week, and then we get a decent assessment of where we stand, the level of our concepts, and how good are we at each particular topic in each subject. And also the faculties also, they were really supportive and really good. They were always entertaining us regarding if we had any doubts, we could always approach them very easily. And also the Facebook community was also really active. So in case if you post any doubt, they were very quick to reply, and also at the same time they were also more into encouraging the students so that the morale doesn't die out, so that we stay inspired and focused.
Any particular teachers that come to your mind that you want to talk about, or you want to mention their name here or thank
So
them?
first, I would like to thank you. Like your radiology class was like really good, and then the anatomy class in the embryology part was really nice, and for surgery, Dr. Kandewal sir, and for orthopedics, and Dr. Dipti Bal ma'am for gynae, and yeah, so and all the faculties were like equally good to me.
Yes. So, and I was also discussing with you the DVT experience that you had.
Yes, sir.
So, how did you enjoy DVT, and in particular with the kind of exam that is happening in AIMS?
Yeah.
How do you think that is valid today?
So, sir, for an exam like AIMS, I think the DVT really plays a major role, because here in DVT session, the format also was really good, because first there was a session on BLS and ACLS, and it was really good, and it was highly interactive also. So we could like the learning experience was really good, and after that all the subjects were like given equal amount of time, like 3-4 hours per subject, and we could actually cover all the major topics were also covered. And for an exam like AIMS, like in this time from this time onwards, we are finding that they are like in the options also we are having 4 pictures or 2 pictures, and we have to select one or the other. So in such a scenario, I think DVT really plays a huge role actually. And yeah.
You also utilize the online testing platform that we have. So,
Yes, I had all your 3 apps in my phone, and actually, I was more into your subject-wise test actually, so that I actually used to like do around 20-30 questions at a go, just like that, whenever I got some time in between, and I could cover around 10 to 15 subjects just like that, and also the question pattern was really more concept oriented rather than just fact based. So for an exam like AIMS, we really have to have a good base, and your concept should be really strong. So the subject wise test series were like really helpful in that regard actually.
So if I summarize that, you utilize the test and discussion as the primary course, and then you use DVT for the images
Yes, sir.
and the ACLS BLS that we use for
Yes,
the
sir. Yes, sir.
emergency discussion that we did in
Yes,
the
sir.
end.
Yes, sir.
And you also utilize the online testing platform, but you kept subject-wise test for the days that you were not feeling like
Yeah,
studying, and you
yeah,
thought,
yeah.
let's do some MCQs.
Yes, sir. Yes, sir.
And that was your prime approach, and this
Yes,
is
sir.
where you utilize the apps.
Yes, sir.
Did you utilize our other apps, like you were telling about other apps like ebooks app and all?
Yeah, I was using after the DVT. You were kind enough to upload all the slides along with the faculty notes in your ebooks. I mean, in your cloud, there's a separate app, and that was like really helpful. So we could actually see and revise, and also the faculty, whatever the faculty wrote on the slides, was also present. So it was really helpful, and in that regard. And I also was using your ebooks app, and I had actually subscribed to your. You had a session like where you have some fun trivia sort of plates where you have around 1,000 to 2,000 slides.
Yes.
So it was like really
Yes.
nice whenever you are like not that into studies, like we are not in such a frame of mind.
Yep.
We can actually just go through just like that. So
In those flashcards, each slide is actually one question.
yeah, it's
One
like that.
question, and that one point is there.
Yeah, one point. And so it's like really, it's not that easy or that fact-based, more of conceptual. In case of pathology, the images were usually, we might think it's something, but it's actually a different concept and different entity altogether. So it was really helpful in that regard.
And Ronnie, I also want to know that do you want to use this opportunity today to thank maybe people in your family and
Yeah.
people back home?
Yeah, definitely. I'd like to thank my family, all the faculty from AIMS and also in DAMS, and all my friends and seniors who were like really helpful. And we had a sort of a study circle, so that helped us a lot. Everyone in the study circle, like we could discuss, and it's actually essential to develop a study circle so we can discuss every time, and so we get an idea of like we get many questions from many people. So many topics would be covered in one go, just like for an half an hour discussion or like 1 hour discussion. And yeah, that's it.
And I've seen, I've seen many toppers actually talk about role of a small study group, maybe 2-3
Yeah.
people together,
Yes, sir.
in between, talking about MCQs, discussing,
Yes, sir.
some topic with each other. That always helps.
Yes,
So, and I'm sure, people listening to you will take home this point that it is good idea to have a good like-minded person. A like-minded is very important.
Yes, sir.
Like-minded person to study together. That also always helps to, motivate each other also. That
Yes, sir.
also works. Not only study, maybe sometimes you are able to pep up each other also.
Yes, sir.
So that also helps.
Yeah, that helps a lot, sir.
Yes. And Ronnie, I also want to use this opportunity to ask you about this particular AIMS exam that you had given.
Yes, sir.
This exam, how did you manage the time? How many questions did you attempt? And how many questions did you mark for review?
Yeah, so actually I attempted around 190 questions.
190.
Yeah, but I have a thing, I never mark questions for review as such.
Yes.
What I do is I like kind of like write down, I mark the questions, save it, and I kind of write down the number of the questions in my, we can actually use a admit cards backside for doing calculations and stuff. So I use a certain, in one corner I just write down the questions, I have to give a second look actually. That's
So
what I used to do.
Maybe that is your backup plan, just in case you are not able to review. So
Yeah.
those questions should be counted
Yeah.
instead of So that's
Yeah.
a very beautiful strategy that is given. That because in an exam like AIMS, you have to understand the platform. In this platform, if you mark something for review, and if you are not able to look at it in the end,
Yes,
that
sir.
will not be counted as an answer. So it is actually better to mark few. Like I've seen, like most of the toppers have done, like they limited the number that they marked for review was around 10 to 15. And his idea was even more innovative. Instead of marking questions for review in the software, he marked them in his paper, so that he, just in case his time is short, he should not miss out on the
Yeah.
question. It's a very beautiful idea that is given. And I want everybody to notice this. It's a very, very valid point to listen to our interview here is, because this year even the NEET exam will be conducted by a same body, because Prometric is no longer conducting NEET exam. So this point becomes very relevant, because in Prometric software, if you mark a question for review, that is counted. But in TCS or AIMS software, if you mark a question for review, it is not counted if you don't uncheck it later on. That is very important to know. I also want to utilize this opportunity and ask you, like, any particular topics that you feel future AIMS aspirants should definitely look at.
AIMS right now, I think the pattern has changed to more of a clinical oriented questions actually. Like there was a question regarding how would you send a blood sample for cross matching, like where would you tag the vial and stuff like that. So I think you would have to have a good base during your internship. So if you are good with that, and also they're not asking some hi-fi factual stuff actually. They are more into emergency, what is the first investigation that we do, and how to manage trauma cases, and how to take a sample, IV cannula, color coding, basic stuff like that. We need to be, I think what we have to do is like we have to be strong in all those topics, and after that further build upon this. After, I think we have to have a strong base first and then further build upon it. Actually.
So my personal feeling by talking to many people has been that this exam probably they have focused more on emergencies
Yes, sir.
and basic clinical procedures
Yeah, yeah.
in addition. But
Yeah.
because the exam patterns are very dynamic, So, sometimes they rotate also. So, but this particular AIMS, this was the key thing here. And I want you people to know that emergency and basic clinical procedure was the focus of November 2017 AIMS exam. In addition to infectious diseases, was also one of the focus point.
Yes, sir.
I also want to utilize this opportunity today, Ronnie, when I'm talking to you, to find out from you, like, you are a high achiever, you are a top 100 ranker in AIMS. So, what is it that makes you, that strong? Like any trait in your personality that you want to highlight today? Somebody would say I'm a hard worker, somebody would say I'm intelligent, somebody would say I'm intuitive. What is your trait?
I don't know. I think I'm more of intuitive actually, because I have this sort of a gut instinct that I guess that works. I think
you trust your gut feeling and the
Yeah,
first instinct in
I
the
think
exam. That's very honest, because I've
Yeah.
seen many toppers actually do that. And sometimes some they do not tell us in the interviews, but it is like you should have that. Once you are able to rule out two choices, when
Yeah.
you are left with the final two choices,
Yeah.
in your subconscious the answer is there.
There, yeah.
Some people ignore the subconscious and they overthink it.
Yeah.
But toppers, they know this is my gut feeling, I will mark this. This is
Yeah.
what he feels is his. And I was waiting one topper to come at least and say this. And I'm so happy that he's saying that gut feeling is one of the key things to always learn to nurture your gut feeling when you're preparing for a competitive exam.
Yes.
And now I want you to say something motivating to the people listening to you.
Uh, what I can say is like you have to stay motivated every time. Like it need not be like it's maybe just one day before the exams or maybe 1 week before the exams. You will have a moment like where maybe you are discussing a topic or you are solving an MCQ where you think all the other people are like covered with the topic, but you might not even have heard of the topic.
Yeah.
So I think that's totally natural. That happens to almost everyone, I guess. So you don't have to be like totally frustrated or anything. You have to stay focused, and one more thing is like you have to revise as much as you can. So what I did was like I gave around 50 days for revision, and I could revise around 2 to 3 times most of the subjects, and also focus more on in case of an exam like AIMS, you have to focus more on image based. So for like photos from standard textbooks like Robbins, Bailey, and from graphs from Ganong. I think they have to go through all this and.
So that is
Yeah,
why,
that's
if you
very
notice, we had compiled the pathology images in
Yeah.
ebook and
Yeah.
from Robbins, and we actually labeled them with markers to make sure that
Sir.
you can understand. Because I also feel that is why, if you notice in DVT we had one session on graphs in physiology.
Yeah.
Because we noticed this, and this is what is important for him. And I like to point out a very important point that he has said. He said 50 days he could do 2 revisions, and I have been actually repeatedly saying that it is not a school, it is a medical college. It takes you cannot revise everything in one day. So keep margin for revision. Sometimes I see people leave revision to the last week. You're not able to revise all subjects in 1 week. At least 25 days is required to do one cycle of revision of your entire notes that you make in medical curriculum. It is not school that you can do everything in 1 week. Don't overestimate that thing. It takes 25 days, and he actually kept 50 days for revision, and he could do a 2.5 day
Yeah.
times the cycle of
Yeah.
revision, and that is the key to actually getting a good rank in the exam. And I would like to summarize that he started with a test and discussion course, gave himself weekly targets, in between practiced subject-wise tests to give himself that extra edge of MCQ practice. In between he flipped through textbook books sometimes to look at images, used DVT for the image-based questions, and image-based questions have become increasingly important because of even sometimes the choices in AIMS exams nowadays has a image.
Yeah.
He utilized the AIMS exam very properly, and he understood the value of marking for review and the time, because the questions are longer in length. Sometimes you don't get that kind of time to review. So that was one of the key things that got him his rank. And in the end, he told everybody, don't be disheartened by people who are telling you that this topic, and you may not know the topic. Don't panic. You may know some topics that he doesn't know. Don't panic. Maintain your cool. With a motivated mind, you will reach where he has reached today. And I would like to now finally once more congratulate him on his achievement, and I wish him all the best for his future endeavors in life. And I'm sure the entire DAMS family is proud of him, and I'm sure he will reach big places in future. We'll hear about him more and more in future as well. Congratulations once more.